In 2001, Dr. W. Kreisel of the World Health Organization prepared a report titled Health Situation in Iraq. It's worth quoting at length because it obliterates the common view of Iraq that was portrayed to me as a kid. Quote, before 1990, Iraq, with a GNP per capita of $2,800 belonged to the group of middle-income countries. The large investments in infrastructures and in human resources development had led to the development of an efficient health system that was considered one of the best in the Middle East. Malnutrition was virtually not seen, as households had easy and affordable access to a balanced dietary intake. Healthcare services were guaranteed by an extensive network of well-equipped, well-supplied, and well-staffed health facilities. The access of patients to higher levels of care was easy and effortless, supported as it was by a distributed network of secondary and tertiary hospitals and institutions. Ambulances and emergency services were well developed and benefited from a properly maintained network of roads and telecommunications. Water and sanitation services benefited from large investments in water and sewage treatment plants during earlier decades, assuring nearly universal access to abundant, safe drinking water and to a relatively clean environment. Electricity had been made available even to remote villages. End quote. Indeed, Kreisel paints the picture of a somewhat modern country. The Ba'ath regime provided free healthcare and education for virtually everyone. Proportionally, Iraq had a very large middle class. But, as has been well documented, the bombing campaign during the Gulf War was one of the most ferocious in modern history. Human Rights Watch would describe the destruction in abysmal terms. Quote, the recent conflict has wrought near-apocalyptic results upon the economic infrastructure of what had been, until January 1991, a rather highly urbanized and mechanized society. Now, most means of modern life support have been destroyed or rendered tenuous. Iraq has, for some time to come, been relegated to a pre-industrial age. The air campaign targeted vast quantities of critical civilian infrastructure, including water treatment facilities, food processing plants, food and seed storage warehouses, flour mills, and even a dairy plant. Being a modern country, Iraq was heavily reliant on electricity, and the deliberate bombing of its electrical grid decimated essential services such as water purification and distribution, sewage removal and treatment, the operation of hospitals and medical laboratories, and agricultural production. A Harvard study team would report on the ground on the effects of not only the bombing, but also the notorious sanctions placed on the country all the way to the second invasion. According to them, war damage and continued sanctions led to a virtual collapse of basic public services such as healthcare, water supply, food distribution, sewage, and sanitation. Pathogenic microbes born in the contaminated water supplies are creating epidemic levels of waterborne diseases. Typhoid, gastroenteritis, and cholera are epidemic. Though many quibble over the number of just how many died from starvation and disease, a figure of 500,000 children was given to then UN Ambassador Madeleine Albright by reporter Leslie Stahl.
We have heard that 500,000 children have died. I mean, that's more children than died in Hiroshima. And you know, is the price worth it?
I think this is a very hard choice, but we think the price is worth it.
Iraq would hit rock bottom in 1994. Hospitals ran out of medicines and even soap to wash bedding. Malnutrition was widespread. Infant mortality exploded. Clean drinking water was unavailable in many areas, and runaway inflation virtually wiped out the new middle class. But despite this, Iraq was miraculously able to make somewhat of a comeback, rebuilding power stations and transmission lines, building bridges and treating sewage. Even oil exports were able to moderately increase, and by 2000, Iraq was earning more than $30 billion from oil exports. Combat for the Iraq War began on March 20th, 2003, while it was still the evening of March 19th in the United States. The reporting of these casualties was not an undertaking of the military whatsoever, which went all the way to the head of Central Command, who said simply, quote, "We don't do body counts on other people." Thankfully, a massive epidemiological study led by Les Roberts of Johns Hopkins University would provide a serious and vitally important figure that would cause a major upset in the liberal press. In September of 2004, the war in Iraq had been going on for 17 months. In just over a year and a half, Roberts et al. Concluded that there had been over 100,000 excess deaths in Iraq. The result of the survey, published in the prestigious Lancet Medical Journal, was vastly different from the figures that were used at the time, which were just in the low tens of thousands. But it wasn't only the scale that made the report daring, but also its assertion that the majority of those killed were killed by the combined US-led coalition. I'll read a sample of the report directly, which is, needless to say, worth quoting at length. Quote, "Violent deaths were widespread and were mainly attributed to coalition forces. Most individuals reportedly killed by coalition forces were women and children. Making conservative assumptions, we think that about 100,000 excess deaths or more have happened since the 2003 invasion of Iraq. Violence accounted for most of the excess deaths, and airstrikes from coalition forces accounted for most violent deaths." End quote. The study describes how before the invasion, the main causes of death were from heart attack and stroke, but that, quote, "after the war began, violence was the most commonly reported cause of death." End quote. Out of a cluster of 61 violent deaths, 58 or 95% were killed by, quote, "helicopter gunships, rockets, or other forms of aerial weaponry." End quote. Data from the besieged city of Fallujah was so eye-popping that it had to be excluded so as to not skew the report. Therefore, the 100,000 estimate was not even a complete number, since the death toll of Fallujah wasn't even included. But these numbers paled in comparison to the follow-up study conducted by a different Johns Hopkins team 2 years later, when the 100,000 figure had increased staggeringly. Quote, "We estimate that between March 18, 2003 and June 2006, an additional 654,965 Iraqis have died above what would have been expected as a consequence of the coalition invasion. The number of deaths attributable to coalition forces could be conservative estimates." The report was met with a flurry of criticism, if it was even reported on at all. Bush dismissed it outright as a mere guess, calling it not credible. Interestingly enough, though, the staff of Bush's British counterpart, Tony Blair, privately affirmed the study's methodology. In a memo obtained by the BBC through a Freedom of Information Act request, the Defense Ministry's chief science advisor, Sir Roy Anderson, conceded, quote, "The study design is robust and employs methods that are regarded as close to best practice in this area, given the difficulties of data collection and verification in the present circumstances in Iraq." End quote. Publicly, though, the policy was deny, obfuscate, and discredit. The period from 2004 to 2007 was indeed the worst for violent deaths, and by 2010, the violence, as well as its associated disruptions, most important of which being the near total collapse of Iraq's healthcare and sanitation infrastructure, causing a rise of infectious diseases, excess deaths in Iraq had reached up to 1 million people.